One thing which we are doing is we will be providing an additional 500,000 masks to aged care facilities in the western suburbs of Sydney, those that have been identified by the New South Wales Minister for Health and New South Wales Health as needing to have mandatory use of PPE over the course of the coming weeks. That's an important part of the Commonwealth's contribution to provide that support, to provide that assistance. New South Wales is stable, and whilst the numbers remain a concern, the advice of the Chief Medical Officer is the speed and the focus of the tracing program and the fact that the community cases have been contained to a link to the Crossroads Hotel is heartening. Turning to Victoria, obviously 238 cases today. These numbers, as the Victorian Chief Health Officer has said, are stable, but they are deeply concerning. So it is a very high level, a concerning level, but nevertheless there is an element of stability. It's too early to say whether it will remain stable. We are in, as Victorians, we are in, as Melburnians, the great fight of our lives. But people are rising to the occasion. They are distancing. They are being tested in record numbers. They are cooperating with the tracing program, and I want to thank them and thank our extraordinary medical professionals, whether it's the pathologists, the aged care workers, the chemists, or of course our nurses and our doctors and our public health officials for all of their work. Having said that, we are stepping in, having offered and Victoria having requested with additional support. In particular, there will be additional military support for the additional needs and workload which the Public Health Unit of the Victorian Department of Health and Human Services is facing. The number one task as a public health unit is to assist with the tracing program to ensure that we are able to track down each case every day and to focus on that contact tracing. So we will be providing a team of logisticians and other ADF personnel at the request of the Victorian Government to assist the Chief Health Officer and the Deputy Chief Health Officer because of the growth in case numbers. That team will be led by a one-star general equivalent, Commodore Mark Hill from the Australian Navy, a specialist in operations, supported by Colonel Beck Taylor from the Australian Defence Force, from the Army, a specialist in logistics, and under Mark Hill and Beck Taylor, they will have a team of logisticians and other specialist personnel. They will be reporting to the Victorian Chief Health Officer and Deputy Chief Health Officer. So we are very much stepping in underneath at the request of and to support Victoria, but this will increase the capacity for the tasking, the oversight, as well as the virtual national network which has been put in place. Other states and territories doing remote tracing, the National Incident Centre doing remote tracing. And I'm advised that that team will start to be in place over the course of the next 24 hours. All of that support is exceptionally important. It comes on top of having achieved the milestone of 1 million Australians who have had infection control training. And I think that's an extraordinary achievement and step forward. Then the other major area of focus in Victoria is assisting with the residential aged care facilities and the latest advice that I have just literally prior to joining you from the National Incident Centre is that there are 8 facilities where residents have been diagnosed with infections in Victoria and 24 where there are staff only, 32 all up. And of those, particularly of importance is the Menarok facility, where the advice that I have is that all patients who have been diagnosed as positive are either in the process of being moved or have already been moved to hospital. And I think that's a very important thing. In addition, the advice I have and the request of the Prime Minister and myself and the Aged Care Minister, we are seeing that there is full cohorting in this and the SDRD facility. So in other words, any residents are being separated so as they have unique facilities. This is something that we've set in place, we've requested. It's being overseen by the Aged Care Quality and Safety Commissioner, Janet Anderson.